Paul, welcome to one of our homes at HC1, which is Douglas View in just outside Glasgow, which is one of our large multi-site homes and managed by the wonderful Louise Fulton. So welcome and thank you for coming today.
No, thank you very much for having me. First impression's amazing. Just integrating with the staff, seeing some of the residents, incredible place. So looking forward to continuing the tour.
Yeah, and I think we've seen some wonderful interactions already between the staff and the residents.
Yeah, and the collection of donuts, cakes, teas and coffees, yeah.
Brilliant.
Fantastic.
So Paul, we started this journey with Radar Healthcare about 18 months ago, I think, when we first met.
Did.
And myself, James Tugendhat, yourself. And we've been on a really good journey of partnership ever since then. And I think we've taken our time to get this right for us and to understand how the system can really help us to not only record incidents better, but to really understand everything about a resident that we need to therefore learn and improve continually. So I think it's been an incredible partnership, and Radar Healthcare have really helped us understand that. And even today, we're getting feedback about how we can continually improve that.
Yeah, no, I mean, yeah, you and I, as you say, 18 months ago when we engaged, I think the thing that came across was that shared vision and passion, that this wasn't just about we're putting a system in. So it wasn't buying a piece of software. It was, certainly from my perspective and our perspective, it was, this is a genuine partnership to drive change and improve the outcomes across those residents. So, yeah, I got super excited. And I know we've talked about some amazing things that we can do downstream, but in the here and now, some great functionality to be delivered and some amazing outcomes.
Absolutely. I think you're hitting the nail on the head about it's not just a system, because the easiest thing in the world would just go out and buy a system and that would do what we currently do, which is basically record incidents and file them. What we wanted is a system that can move us into the direction of giving us the insights as to exactly what's going on with a resident and to really understand them as a whole. And the partnership with the Radar Healthcare has got us to that place, I think.
Yeah, no, definitely. And I think what was interesting was in those early days when we had the conversations, front and centre were your homes, your people, the residents. Whereas sometimes when we engage with, people that are interested in Radar Healthcare, it is at a functional system perspective. Whereas we found with HC1, it was actually we're starting with the resident, starting with how we do things as an organisation. And that was front and centre in terms of, in fact, right to now is how we're going to deploy and roll this out.
Absolutely. And that aligns with our principles of being the kind care company, and our whole approach to kindness when we deliver care is about, at every resident level is understanding what is it we can learn to make their life better. So if somebody's falling and they're falling continually, why are they falling continually? Not just counting how many times they've fallen and where and what time, but why, and how can we stop them falling again to keep them safe and give them a better quality of life. And right through all the incidents and events that will be recorded in Radar Healthcare, that's absolutely key, is that level of understanding at the resident level. And then all of that reporting gets aggregated up to people like me, but actually it really matters about how it improves that resident's life each day.
Yeah, and I think that was it. I mean, you touched on it there in terms of the reporting and the insight. And again, we had these conversations very early on that... And you mentioned that things get aggregated up to, to yourself and others, but actually what you wanted to do was put it in the hands of the carers, the home managers, the insights that they, and the benefits that they can derive to apply directly to their homes so it impacts their residents. Absolutely. I mean, that came across really clear.
Yeah, and I think that's really important. So if you take the manager here at Douglas View and any of our homes, at the moment, they have access to sort of data, which is basically just numbers of things that happen. In order to really continue the wonderful work they do in the homes, we've got to give them the insight about what's going on. So that might be trends, but it might be about, for example, how people's, if somebody falls or somebody has a wound or whatever, why did that happen? And what could we do better next time? And we have a unique opportunity at HC1 as well, because we can do that at a local level and understand each resident. We can then move it across the whole organisation, given the numbers of homes we have and the number of residents we look after, to do learning on a massive scale. And so, we talked right at the beginning that actually this isn't just a safety system for us and a recording system, it's a learning system, and that's fundamental to us.
Yeah, absolutely. I know we're here in Douglas View, and I already met with Louise, and her passion comes across. But, one of the things that she flagged up was there's absolute commitment within this home and every home within HC1 to deliver amazing care. And then some of the elements mean that they get quite stretched. And so one of the benefits and outcomes that we discussed was to ensure that we bring those efficiencies. Yeah. So there's a lot of automation, but the key point being is, how do they make sure that they continue to live that amazing care and improve that care? So that is it can't just be an instant reporting. It has to be a learning management system and a supportive system that's going to help make informed decisions and affect change. And Louise already looking to drive that, which is incredible.
Yeah, absolutely. How powerful would it be that the learnings that Louise identifies in this home are also understood by our homes in London or in Wales or any part of the country? We've got an amazing opportunity to share that learning.
Yeah, I mean, that's directly aligned to us as well. So one key function within Radar Healthcare is our Radar Healthcare community. And so it's not just that people within HC1 are connected. All of our customer base, all of our partners are connected, and so that you get that shared learning. But yeah, I mean, exactly what you say. You get some great insights, and I know something we discussed as well, which was reporting excellence.
Yeah.
So a real driver to quality it shouldn't always just be the adverse, events. It is where we see excellence, and you see excellence within HC1. How do you capture that? How do you define it? And then how do you share that? So this project and the rollout of Radar Healthcare with HC1 will give us that opportunity to really share best practice, implement it, and learn from that and drive change.
Yeah. And I think that's a really important point about the excellence, because all of our homes do incredible work every day. And I was saying to somebody earlier, I think on average we deliver about 7 million care interactions a year. Yet our incidents are around about 65,000 a year. So think about that 6.5 million of care interactions that are really positive every single year that we need to celebrate and learn from. And I've seen today, as we've both seen, some wonderful things happening in this home. And I want to make sure that we all understand that across all of our homes, because that will definitely drive improvement forwards.
Yeah. I think, again, just speaking to the local team here and some of the engagements we had prior to this, there is a thirst for having a system, because it's these guys within your organization that want to drive, the best outcomes. They're so passionate about it. Came in, as soon as we walked through the door, it was immediately, I want this, I want that. How can it help me do this? So, I feel this partnership will help satisfy that thirst for giving them the systems and tools to drive that change.
Well, absolutely, because every colleague I meet in this organisation and other care providers, they work in care because they are passionate about delivering better outcomes for people. Yeah. And it's really important that as a company, we give them the tools to enable that. Because, as you say, that's what they want to do. They don't, Louise and her team don't come here every day just to do the same job. They constantly want to give people the best possible life. So we need to give them the tools to enable that in a simple way, but in an insightful way.
Yeah, I mean, this is you're practically defining our mission statement. Yes. And so we were saying there, what do you do? And sometimes you can say, we have a learning management system, an incident reporting system, but fundamentally, we have a system to help organisations like yourself deliver better healthcare outcomes. And I think that, as the anchor point of this partnership, is what's helping us drive these decisions and the direction of travel that we want to go.
And fundamentally, if you focus on resident outcomes and improve people's quality of life, all the things such as regulatory outcomes and things will flow from that. Okay, that's got to be the key driver about building the information and the improvement around each individual resident.
Yeah, invariably, if you look at from a regulatory perspective, where you get homes that are rated at the highest level, it always comes back to the resident and the outcome that they achieved. So you're right. If you work back from that, invariably you'll have quality outcomes and metrics that have been applied across the organisation. So.
Yeah, absolutely.